Good afternoon, Congressman. My name is Stuart Williams, and I've lived in Lubbock all my life. I'm 19 years old, and I go to Texas Tech full-time. Since I go full-time, I am employed during the summer. The last 4 years, I've worked for the Attorney General's Office Child Support Division. And my question to you is, 1 in 5 people in Lubbock, like myself, are uninsured. I grew up on S-chip. I come from a single-parent home, and my mother is on health insurance, but we just don't have the funds to get me on something. The figures show that emergency care costs more than preventative medicine, which a public option would provide. Currently, Lubbock County, Texas, fund uninsured trips to the county hospital emergency room. Being a good citizen, I don't want to put myself off on the charity of others and people's tax money. And being that this is, why do you support wasting taxpayer money?
Well, I don't support wasting taxpayer money, and I do understand that unfortunately a lot of people are using the emergency room for their health care. When you look at the numbers of people that are uninsured in this country, it is an interesting number. There are a lot of different statistics out there, and some of them say between 88 and 92% of the American people have some form of health plan. So that means that about 10% or 8% of those people don't. Even the president's own plan says that we're going to spend about $1.5 trillion, and we're only going to increase that to 3 or 4%. So we're going to go from 90% to 94%. But the other piece of that is we have a number of people that just choose not to have health insurance. We have a number of people that are unfortunately not in this country legally that are not on health insurance because they're afraid to.
I understand that. I was born here. And
I'm not saying that. I'm just telling you that I was not accusing you. But so there's a lot of people that choose, and there are people that are making $60,000, $70,000, $80,000 that just choose not to have health insurance. They're going to wing it. What we do need to do, and as you heard me say from the beginning, is look at ways to make healthcare more affordable, accessible, and available to everybody. And what we want to do is, for example, help employers help you do that. And one of the things that I wanted to brag on is the Lubbock Chamber of Commerce, because they've been on the forefront. They've been very innovative about helping their businesses, small businesses in Lubbock, Texas, come up with a very affordable health care plan. And I believe the number, and they're in the room, but I think Norma told me that when they did this plan, 40% of the people that are on now the chamber plan were not insured before the chamber did that. So if the chamber can be entrepreneurial in that way and use some innovative thoughts and ideas and work to increase the ability for employers, and you said you were employed, to be able to provide or help you or a partnership with you on health care, those are the kind of solutions that I want to be working on. And then we can take the pressure off of the hospitals, that they're not the primary caregiver, they're the caregiver of last resort. So again, I am not ready to turn the everybody's health care over to the federal government to get a 4% increase or a 5% increase in the number of covered people without trying some of these other options that I believe can yield lower, better quality health.
I have lived in England and other countries. I've seen socialized medicine and government intrusion into private affairs up close, and I don't want them here.